I'm Dr. Charles Kapela Mwandama. I'm from Zambia. By training, I'm a physician in internal medicine. So I'm here at B.Sc Cancer Institute, enrolled to do a adult hemato-oncology training. So I'd like to give special gratitude and thanks to Merck Foundation, Tata Memorial Hospital, and B.Sc Cancer Institute for having given me the opportunity to enroll under this Merck Access Africa training program. Okay. So in terms of challenges that we have back home in Zambia, we have a population of about 18 million. So when it comes to trained expertise in terms of doctors that are trained in cancer management, like oncologists and other paramedics like nurses, nutritionists, palliative care, our numbers are quite few. Like currently in Zambia, we don't have a trained physician like myself who's trained in hemato-oncology. Currently, we only have 2 hematologists, and looking at our population is quite big. So we need, I'm hopeful that after this training, at least it will improve. It's a drop in the ocean, but it will go a long way in improving the expertise in this particular field. So in terms of my expectations of this training, my expectations were that at the end of these trainings, in terms of knowledge, I expect that I'm going to have the most current information in as far as the latest information in hematolymphoid malignancies, in terms of pathology, in terms of diagnostics, and in terms of therapeutics. I also expected that at the end of this program, I would have seen as many patients as possible in terms of according to my area of study, so that when I go back home, I would have encountered in physicality all the major hematological conditions, the one that I read up in textbooks, so that this will at least will capacitate me to manage the patients with confidence when I get back home. Okay, so in terms of exposures, this training was a hands-on training. I had an opportunity to interact with newly diagnosed cancer patients at the time of their first presentation. I was able to clock them, get a physical history, do a physical exam, and I was able to risk stratify the patient based on the presentations. Then I was also able to design investigations required to come up with a diagnosis. After that, I had an opportunity to interact with our professors, our lecturers, to design a treatment protocol or a treatment program for the particular patients. Then we also had an opportunity to follow up the patient after commencement of the treatment. Yeah, but the challenges came in when the COVID-19 came onto the scene. It meant that we had to reduce the interaction with the patients to avoid catching the infection. So even during the physical exam, we had to minimize physical examination to just the relevant aspects. So my advice to those people that are prospecting, like thinking of enrolling on this program, 1 year is a short period. So my suggestion is like you learn running. From the word go, try to interact with the patients as much as possible, and try to consult widely with the lecturers, with the professors, because that way at least you can maximize the 1 year period. After going through this training, maybe I've got a few suggestions that I would want to make. Firstly, I would want at least the program should have a course outline. Speaking for hematolymphoid and the other program, we should have a course outline, because if you have got a course outline, you are going to have targets that maybe after 3 months, I should have covered this knowledge base. I should have acquired these competencies in terms of procedures. So that will go a long way. At least you are going to have targeted at each particular time of the course, at each particular time of the course. Okay, the other improvement that I would suggest to be made on the program is the issue of language. We had challenges in communicating with the patients because most of the patients here in Guwahati don't speak English. They speak Assamese and Hindi. So it was a big challenge in getting a good history and a physical exam. So I would suggest, if it's possible, the first few weeks of the training, at least the people that are enrolled in this program can be exposed at least a few words on how to get a simple good history and to communicate with the patient. It will go a long way in patient interaction and getting a good history. So if I was to be asked two important things that my Minister of Health back home can concentrate on to improve cancer care. So basically break it down to cancer awareness as one. In cancer awareness, I would want us to improve education, especially to both the patients and the care providers, on cancer prevention and early signs and symptoms of cancer. Because what we normally get at my hospital is patients are referred quite late. So if we can focus on cancer awareness to both patients and the care providers on early symptoms and signs of cancer and any other strategies that we can use to prevent cancer. The second point is improving on the cancer care. And this, I can break it down to this in terms of diagnostics. We're still lacking. We are not able to do basic investigatory requirements. The things that we require, like proper histopathology. We're not able to do PET scans, CT scans. And then in terms of therapeutics, I hope we can have all the therapeutic agents that we need, because that way it will allow us to make a difference after this training.